Tonight, unfortunately, we do not have Mayor Pro Tem Don Heilman, so we will have Councilmember D'Amico present in his stead, and we will also have him joined with Commissioner Reback, who will present our final award of the evening, and that will be presented to Cheryl Hoffman.
Cheryl Hoffman has been working as a health educator and advocate for the trans community for over 20 years. Over the years, Cheryl has worked in many roles as a case manager and health educator. Cheryl's personal experiences have shaped who she is and have made her the dedicated community outreach worker that she is today. She has worked to connect trans women to a myriad of services such as medically monitored hormone replacement therapy, HIV care, mental health services, and housing. Through outreach, skills building workshops, transitional life skills, and support groups, she carries the message about HIV prevention and care. Andrew?
Thank you again, Councilmember D'Amico. Friends Community Center is the Los Angeles community site for Friends Research Institute. Friends Community Center, which is directed by Dr. Kathy Reback, provides services for and conducts research with substance-using gay and bisexual men, other men who have sex with men, and high-risk transgender women. The site is located on the border of Hollywood and West Hollywood with easy access to public transportation. The overall objective of the prevention program is to reduce the risk that can result from drug use by preventing HIV infection and managing the physical, psychological, and psychosocial manifestations of drug use without the requirement of absolute abstinence or recovery. The prevention programs are designed to increase social support and teach survival skills while participants gradually change their behaviors. We thank Cheryl and Friends Research Institute for their commitment to the health and well-being for our community members. And I am especially proud of their work. Accepting the 2020 Warrior Awards is Cheryl Hoffman. Thank you so much.
Hi, thank you all so much. I was encouraged to share a little bit about myself, so I have a little bit of a introduction about myself, if you can bear with me.
Take your time. We want to hear it all, Cheryl.
Thank you. That puts me at ease a little bit. Thank you so much. I was born in a small town in central Kansas, the child of an Air Force captain and his wife. As my father was promoted, he was stationed in Omaha, Nebraska, Hawaii, and Northern Virginia. In 1968, he was sent to Vietnam, and we moved back to Kansas to be closer to relatives. It was that year that I began to have difficulties in school. As I was assigned male at birth, but felt female, and I acted as such, this brought about much teasing and bullying in the classroom. I was misunderstood and misdiagnosed with a mental illness, which resulted in my being institutionalized from ages 12 to 16.
Wow.
Yeah. Upon leaving the Mental Health Institute, I drifted for 3 years, not really understanding my authentic identity until I was 19. And that's when I learned the term transgender. And I realized that that was my identity. I immediately began my gender transition and gender confirmation surgery. I had that at age 22, which was quite an unusual feat 41 years ago. After many years of turmoil during my youth, adolescence, and young adult years, it was a true relief to finally be comfortable in my skin. I entered the workforce in cosmetic retail sales in a department store setting and found my niche. As I'm people-oriented and love makeup and fragrances, selling cosmetics was a perfect fit. After some years in the field, I went on to work in a brokerage firm, then into banking. In 1998, at age 41, I found myself in a Los Angeles day spa working there, but I had no health benefits. I was getting my hormone replacement medication from the BART clinic in Hollywood when I learned of a community-based organization that was looking for a peer advocate for community outreach specific to trans women. I interviewed and was hired. I was able to reach out to other trans women and give them the promise of a better life by my example. I learned the field of HIV prevention and provided information about HIV education and medically monitored hormone replacement therapy. I worked in the field of HIV at a couple of different agencies. Having gained additional experience as a case manager, I began working at Friends Community Center in 2016, which then culminated in a position as a case manager there for both trans and MSM populations. I'm still at Friends Community Center, where I work as a health educator with trans women and MSM in an HIV risk reduction setting. Through outreach, skills building workshops, transitional life skills, and support groups, I carry the message about HIV prevention and care. I have now worked in the field of HIV prevention and care for 20 years, and I can truly say it's been a rewarding 20 years and has provided me with personal and professional growth and gratification. I'd like to just say thank you to Mayor Horvath, Congressman Schiff, Ron Galperin, and the West Hollywood City Council. I'd like to thank also Dr. Kathy Reback, who's Executive Director at Friends Community Center, for nominating me for this prestigious award. I'd like also to mention my many coworkers with whom I do this very gratifying work in the field of HIV prevention and care. It's been a most rewarding experience for me. I'm very pleased and humbled to be among the other recipients for this great award, the Paul Andrew Starkey Warrior Award. Thanks again.
Thank you. Very nice.
Thank you.
Thank you. I would like to kind of wrap up since we're at the end of this. And first off, I would like to thank all the awardees. Your stories all were very touching. It's very hard for me not to get through one of these without crying a bit. And in person, I have had difficulties. I've tried to figure out how to do it without crying. And I finally just given up and just go ahead and cry. What the heck, you know? I would like to thank all